those in the Fort Riley community, sir, who may not be familiar with your role, can you tell us a little bit about what the Acting Assistant Secretary of Defense for Health Affairs does? And then secondly, what brings you here to Fort Riley for Fort Riley?
Sure. The Assistant Secretary of Defense for Health Affairs is, best way to put it, is the CEO, the Chief Executive Officer of the military health system. I'm the principal advisor to the Secretary of Defense for all matters related to healthcare in the military health system, be it healthcare delivery at our MTFs, and also including the operational environment. The biggest area that people know about that the ASDHA has purview over is the DHA. So the Defense Health Agency, which is the organization that now runs all of our military treatment facilities. So in this regard, I'm really what I consider to be the person who sets the vision, makes budgetary decisions and personnel decisions related to the military health system. And importantly for our folks in the field is one of the most important roles I have is I feel I'm their voice. So that's a big reason, your second part of your question of why am I here at Fort Riley. It's really important for me to get to the deck plate, to get to where people are doing the work so that I can understand. I find that each site, whether it's a hospital or whether it's an operational unit, is incredibly unique. It has its own mission. It has its own texture, so to speak. And so getting out to where the work is done is really invaluable to be able to help drive decision-making, find out things people need or resources, helping them succeed. And because my number one priority, and folks who've heard me speak before, seen what I've written, is our support to the warfighter and is his readiness. And so those are the things that I really want to do to help every site succeed and actually every member of the military health system to maximize their potential. So that's why I'm here at Fort Riley, because it's a really important part of our mission. The 1st Division is incredibly important to the Army and to our national security. So how we can support the healthcare here in rural Kansas is really important. So I'm here to find out what I can do to help make them the best hospital they can be to support this mission. When you're back at the Pentagon, information that comes to you is always highly curated, highly filtered. That's the nature of such a large organization like ours. We take care of 9.5 million beneficiaries in a worldwide healthcare system. So when we look at, say, I don't like to think of Fort Riley or Irwin Army Community Hospital as a line on a spreadsheet or a slide on a PowerPoint. I want to see the work that's being done. So it's a complex organization here. So to be able to understand, I know they have a big mission for obstetrics and gynecology. So how we can make sure they're optimizing that. Healthcare for military families is one of the most important things for recruitment and retention. It also is really critical to ensuring that our soldiers are able to stay focused on their mission when they know that they or their family are getting high quality healthcare. So I want to make sure that I'm able to help support that in every possible way. This is a beautiful facility. It's a brand new facility. We want to maximize the use of it. That is my absolute priority. So it's helpful for me to come here because, again, there's some texture that's lost in translation between the deck plate. I'm a former Navy guy, so excuse the jargon. Between the deck plate and the Pentagon, there can be a gap. So I think there's no substitute for coming here and talking not only to the leadership team here, but the people doing the work, the soldiers, the doctors, nurses, technologists at the front lines of doing the work.
Where we fit in the network in terms of radius for coverage and things that.
Because what the community wants is access to high quality, timely, state-of-the-art healthcare for their families and for themselves. And so that's what they want, and that's what it's a fair expectation that they have, that they'll be able to receive that. And so I want to tell them that I'm committed to ensuring that they have that. So that's first and foremost. I know that's a big reason why, people have choices, and people, not only is it a readiness factor to make sure our soldiers are ready to deploy, I always say they have to be ready to fight tonight. It's an important part of our mission to make sure that we have a medically ready force. But again, for those family members, to make sure, again, that those soldiers, their families, their children have the care they need. So if they go downrange, they know that their family is in excellent hands. And then that leads right into my message for the staff here at the hospital is their job, it's a really a matter of trust. It's the compact that we form with those families and with those service members that we will deliver on that promise I just made to them. And so that they have the resources, and the resources mean the people, the money, the equipment, the supplies that they need to be able to carry out that mission. And so coming here really helps me figure out where the gaps are, what are some creative solutions we can do. I think everyone, and I'm always inspired also when I come to places because this is a resource-constrained environment. That's not a mystery to anyone. It's not a secret. So what I'm always impressed by is people's ability to innovate and to adapt and to solve problems either through sweat equity or through great ideas. And so to come and figure out how I can help do those and not only help them execute on their plans, but when they do best practices, share those with other places because we're all in this together. This is a giant team sport across the military health system.
A few folks here at the hospital are anxious about what the future holds for IAC, especially in light of the broader challenges across the Defense Health Agency. What would you say to reassure those who might be feeling uncertain?
Yeah, I understand their uncertainty, and that's another reason why I'm here is because I want them to be able to ask me the hard questions so they can hear it from me of why we, how we make the decisions we make. And first, I, want to tell them that it's part of my fiduciary and my leadership responsibility to look at all of our places. I don't just look at IAC. I look at everywhere from Brooke Army Medical Center to Weed Army Community Hospital at Fort Irwin, to make sure that we are managing our resources and we're managing our mission as well as we possibly can. To me, the definition of success for a hospital is a busy hospital doing high volume, high complexity care. And I want all of our MTFs to succeed, and especially IAC. So my goal is to figure out how can I make IAC even more successful. That is the reason I'm here. And I know people talk about, we're going to downsize and so forth. I don't want to downsize IAC. That's not my goal. But I want to make sure that they're getting enough sets and reps so that if, God forbid, they have to do what our military and healthcare mission is, which is to support, service members downrange, that they feel as ready as they need to be, that they've been active in patient care, that they've, whether you're a surgeon or whether you're a technologist or whether you're a nurse, that you've been doing that patient care, that high complexity, high volume work, that's going to make you ready to be able to take care of soldiers on the battlefield.